Hello, I'm Amy Ventitullo, WCTV. We're back with another You Ask, We Answer, addressing your questions about the impacts of staying at home and projections for COVID-19 in Washoe County. With me today remotely is Mr. Kevin Dick, our Washoe County Health District Officer. Kevin, thank you so much for joining us.
Thank you for having me.
So our first question is, do we have any data that supports the impacts of staying at home?
So we don't have any data in our community at this point, but we do know that other countries that have used the strategy of having people stay at home have been able to reduce the spread of COVID-19 in their communities and basically come out on the other side of the surge in COVID-19 that was occurring there. And we have projections of how many cases we would have and how quickly if we were not using a stay-at-home strategy to avoid the spread of the disease. And we have projections that show that strategy and that flattening the curve of the increase in COVID-19 and pushing the peak further out in time. So we believe that it's an important strategy for us to help prevent as many people from getting the disease, the strain that puts on our healthcare system, and reducing the number of fatalities that will occur from the disease.
Thank you. For our next question, can you better explain some of the recent projections we've seen that have come out about COVID-19 impacts here in Washoe County?
There are several groups that have been working on COVID-19 projections, and the state of Nevada Department of Health and Human Services has been working with UNR and University of Michigan professors to be evaluating the different projections that have occurred out of those models. There's one model that is showing that we may hit our peak of our healthcare resource utilization in responding to COVID-19 that gives us a date of April 20th, and that's for the state of Nevada as a whole. There's another model which incorporates how it would look differently if we had our stay-at-home program, which we do, that will prevent people being out and spreading the disease, and one that's a model that shows if it's really, really stringently adhered to by everybody in our community to stay at home and do their best not to spread the disease. And that model shows that with the stay-at-home strategy in place, as we have it, that extends the date from April 20th all the way out to May 12th as to when we would have our peak utilization of, or exceed our capacity for utilization of our healthcare services. The model that has us really stringently adhering to the stay-at-home spreads the peak out even further out in time, and it shows that if we're really good, we never exceed our hospital capacity to provide those health services. So it's very important that we use our stay-at-home strategy. It gives us more time to prepare for that surge and build surge capacity into our system. And as I mentioned, if we are very stringent and adherent to the stay-at-home, we may actually come out of this without ever exceeding our surge capacity. And obviously, the more that we can do with this strategy, it's the fewer people that get sick from the disease, fewer people that die from the disease.
Thank you, and thank you so much for joining us, Kevin. We appreciate it, and thank you for tuning in. I'm Amy Ventitullo, WCTV. We look forward to taking your questions on our next You Ask, We Answer.